How?
Healthcare certainly has taken center stage over these last several months, and thank goodness we all feel for those frontline medical workers who have been there to assist us every step along this COVID journey. But as we all well know, there are so many more areas in our lives where these physicians and the nurses are still stepping up to take care of us, and perhaps nothing else stands out quite as much as the cancer services that we see around the area. Breast cancer in particular is a focus at CHI Memorial, and we are so happy this morning to have Angie Stiggins join us. She's going to talk about the new facility opening down in Ringgold with the breast center there. Good to see you this morning.
Good to see you. Thank you for having me this morning.
I'm thrilled to have you, and I will let people know that as a courtesy to our viewers, you've taken off your mask, but certainly that's part of your daily protocol with all of the staff there at the hospital.
Yes, ma'am, it is. We, everyone at the facility, when you come to CHI Memorial Parkway Imaging Center, we will all be masked and making sure that we keep our team safe and our patients that come in safe.
So you had the right vocabulary. I did not, and forgive me, it's been a long week, so I garbled my words a bit, but it's not, what we're talking about this morning is not connected with the hospital. This is an imaging center there in Ringgold, and you have some new technology you're bringing in terms of breast cancer detection. Is that right?
It is connected with CHI Memorial Hospital, directly connected with the Georgia campus. And we do have several imaging services here. We have CT, we obviously have CT, MRI, diagnostic imaging, as well as a Mary Ellen Locher Breast Center, where we have a full service breast center. We have 2 and 3D mammography, breast MRI, and breast ultrasound for as imaging services to offer our North Georgia community.
So I guess one of the things that can throw people so much when they first begin to understand the passion that you all have there at CHI Memorial is the fact that what you want is your services to be available to as many people as possible. So am I right that you don't have to be a patient at Memorial to utilize the imaging center?
That is absolutely correct. You do not have to be a patient of Memorial. You do not have to have a Memorial physician to come and use this facility. It is open to everyone, and that is absolutely a goal of Memorials, is to make access to healthcare easier for the patient and to bring healthcare to the patient where they are in their home community.
You know, certainly your hope, I'm sure, is that with each mammogram done, the results come back negative and women can go on living their lives. Sadly, that does not always happen. And when there is a need for breast surgery, you've got some special members of your staff. Am I right that they're the only fellowship trained breast surgeons in the whole region? I'll let you kind of brag on that fact.
Yes, ma'am, you are correct. We're so very proud to have Dr. Nicole Walker, Dr. Betsy Washburn, and Dr. Tequila Williams. They are the only fellowship trained breast surgeons in the region, and we are so proud to have them at Memorial. We are blessed to have them on our team. And they are very active here in the imaging center as well as with Memorial, obviously.
So where you're joining us this morning, the bed that we see behind you, that's actually an x-ray table, is that right?
It is, yes ma'am, it is. It's a diagnostic imaging table, and we would love to have patients come down and use it.
How quickly do you tend to get the results back? And if you come in for a mammogram and you expect it to be routine, and they discover something or they see something that's even suspicious, how quickly do you act?
Well, we do have a radiologist on site reading those memos, so the turnaround is very quickly. And as I said, we have a radiologist that interacts with the patient and the team here on site, so that we service our patients very quickly.
We've talked before, but I'll let you mention it again for those who may be hearing it for the first time. There is a difference in 2D and 3D mammography. One of them is better utilized if you have dense breast tissue. Is that right?
That is correct. Yes, ma'am. And our team of experts here at the Imaging Center and throughout Memorial work with our physicians to determine which is the best methodology for our patient.
Okay, so here we are in this COVID world. I know you wanted us to point out that when we're through talking, we'll put that mask right back on. One thing that healthcare facilities across the country have struggled with these last months is to remind people that you are very, very safe for them to come and visit, because you want that maintenance care, preventive care, to still be front and center. But some people are still a little bit reluctant. So do you have, am I understanding this correctly, a virtual tour that people can utilize?
We do. We have from August the 9th through the 31st. You can take a virtual tour of the imaging center, and at the end of the tour, you can register to win fantastic prizes that we have available. But the virtual tour will continue to be available, and we just feel that it still gives the community an opportunity to see inside at the amazing facility and our team and the amazing things that we've done with this.
When you talk about the Mariella Locher Breast Center down there being comprehensive, what does that mean exactly?
It means that we can take care of the patient in a one-stop shop, if you will. We can take care of them when they have a mammography. If that were to show something questionable, then we could take them immediately and do an ultrasound on them to further diagnose or clear up any questions that the physician may have or the radiologist may have when they're reading that study. We can take care of the patient in real time, and it just keeps the patient with gets some peace of mind quicker, and gets our patient taken care of sooner.
Okay, and in terms of getting in to have the mammogram done, do you do walk-ins? Is it appointment only? And is it available for people on the weekend?
We absolutely take walk-ins, and we welcome people to walk into our center. We ask that they do wear a cloth mask when they come in, but we do take walk-ins, and we start at 7:30 in the morning, Monday through Friday, and we close at 7 o'clock in the evening, and then we are open from 8 to noon on Saturdays.
All right, well, Angie, thank you so much for sharing a few minutes with us this morning. We so appreciate it, and how wonderful that you have that to offer now at the campus there in Ringgold.
Thank you so much for having me this morning.
So here's the way you can schedule your mammogram, although as you heard Angie say, you are more than welcome to walk in at your convenience, but the phone number is 495-4040. You can go to memorial.org/Parkway, and the imaging center number is 495-7678, right there on Battlefield Parkway. Thank you so much.